Good morning and welcome to the WAVY Digital Desk. I'm your host, Sarah Good. Today we're going to be speaking about a new warning from the FDA about compounded semaglutide injectable products. Now, we've heard about semaglutide from not weight loss medication, from obesity medication and diabetes medications such as WAVY or Ozempic. People have been using them for weight loss medication, but that is not the FDA approved use. So we're going to speak today about, what those overdoses look like, what might happen if you overdose on prescription medication, and more with Dr. Rose, who I'm going to bring on now. Dr. Rose, thanks so much for joining me this morning.
You're welcome. Good to be with you.
And you're with Virginia Poison Center as the director, and we've spoken before about different poison issues that have occurred, especially in the Hampton Roads area. This is now a national issue that we're talking about that impacts, obviously, both people locally and across the country. But just tell me a little bit about, when you all first started hearing maybe about, issues with these injectables.
Well, these are relatively new drugs intended to treat diabetes. They enhance insulin release, and they may actually decrease another hormone called glucagon. And as these drugs gain some experience, it was discovered that they actually have some effects in the brain, one of which was to decrease appetite. And so what we're starting to see is more of the use of these drugs for weight control and for appetite suppression. And these are injectable drugs intended to be given once a week. And whenever that type of administration happens, there's always some room for human error in making sure you get the right dose. But now that these drugs are getting more difficult to get, quite frankly, the weight loss market is using up the drugs, that people are turning to the internet and compounding pharmacies, which may or may not be legitimate, and that's where we're seeing the problems with poor dosing of these drugs or excessive dosing.
Absolutely. And just in a more general sense, how important is it to take medication as prescribed by your provider, to take it and make sure that you understand how to self-inject if that's the way, or how to self-measure medication?
Well, of course, it's critically important to take medication as prescribed. And that's also very important for over-the-counter medications. Exceeding the recommended dose can be even very harmful for them. But this also stresses the point of communication. It's so important to communicate with your doctor, communicate with your pharmacist, make sure that you understand both verbal and written instructions on how to accurately take these types of medicines.
And we've heard about drug shortages of some of these products, and especially as type 2 diabetics, needed to get Ozempic, or people experiencing and needing anti-obesity medication, wanted to get their hands on WAVY. We've heard about drug shortages, and we've heard about the need for generics. But right now, the FDA does not have approved generics for these products. When you get into that territory of, sort of going off-brand or off FDA approval, how risky is it in a sense of, trying to manage maybe these overdoses of things you don't really know what's in the drug?
Well, I think the risk for these particular products are twofold. One is if you buy one of these products off the internet, some of the products let's say most of the products have the active drug semaglutide in it, but they may differ than what's on the label. They all may differ in concentration by 20 to 25 to 30 to 40%. So the what you buy may have a more drug than what's on the label. It also may have contaminants depending on where the product is made. The other thing is that the prescription products, the legitimate products, come in a pre-filled syringe. So the dosing is pretty simplified. If you buy these over the internet, there's a good chance you're going to get a vial of the medication and some syringes, and you have to draw it up yourself. And some of the instructions aren't clear. Sometimes they say to use units or milliliters or milligrams, and that can be very confusing, and that's where we're seeing these dosing errors occur.
And the FDA has said they're taking a look at what you mentioned, counterfeit drugs online, illegal selling of these drugs online. When you're purchasing drugs over the internet and not through a licensed provider, Just explain. I mean, obviously, that seems to me that you can run into some very dangerous risks.
Well, you certainly can, and it's not unique to this class of medications. And we've seen this plenty of times in the past where people might go to convenience stores and gas stations and buy off market, black market, if you will, products. And, this goes back to stress the communication that providers and pharmacists need to counsel our patients about the risk of doing that. That it's a little bit of buyer beware. So you may not really get what you think you're getting. It may be a different concentration or strength, and it may be very difficult to dose accurately.
And I thought one of the interesting things the FDA is warning about too, and saying semaglutide, compounded versions might not have the same active ingredients of the semaglutide that you want to find in Ozempic or Wegovy. So they mention an active ingredient. I think they called it semaglutide with salt or some variation, but not having the same active ingredients and not having that tested, maybe not having that be something that could give you results. So now you're ingesting something that has not been tested and also is not effective. I feel like that just also leads to a very dangerous situation on understanding what the active ingredient is in the medication you're receiving.
Well, those are good points. I mean, certainly compounding pharmacies, and those are pharmacies that put medicines together. They don't come from a manufacturer. Now, they play a huge role in medicine today, and a very important role. But the point is, those medications are not tested by the FDA, and if it comes from a legitimate licensed compounding pharmacy, the chances are you're getting good medicine. Now, several years ago, there was a problem with a compounding pharmacy up in Massachusetts that was dispensing medications contaminated with a fungus, and that was a problem. But many of these compounding pharmacies that are selling semaglutide and other similar products because of an enormous now customer demand may be illegitimate, unlicensed, and therefore their facilities may not be sterile, and they may not be using good manufacturing practices, if you will. So there's the compounding pharmacy, which produces medications typically okay, but not FDA tested, and then you have illegitimate pharmacies and suppliers dispensing medications to meet a consumer demand that may be potentially harmful.
And to your point, compounding pharmacists, can be super necessary in terms of mixing certain, whether it might be a cream, pills, whatever you're getting. That is a necessary job. So this is just to say that this compounded injectable is something that the FDA is warning about.
That's correct, and I think there are not all of these are or problems. I mean, there are
Mm-hmm.
cases where people have gotten um, the medication. It's in a vial rather than an injectable pen. It was accurate. They gave good instructions, and so not every case has a bad outcome for sure. But the risk of a bad outcome just becomes much higher as you introduced all these potential problems, not only with the product, but also in administering the product.
And some of these, adverse effects or impacts required hospitalization. In terms of, getting to that point of maybe seeing what the effect of certain medications are, certain overdosing on medication, what are some of those symptoms that, should raise red flags and make you call someone like the, Virginia Poison Center to sort of figure out what the next steps are?
Well, sure. I mean, anytime you have a question about a medication or you think you might taken too much, a call to the Poison Center would be the first thing to do, because we can help you assess the potential severity of whatever happened, and help guide you into what type of care you might need. In these cases, excessive doses very commonly cause gastrointestinal symptoms, nausea and vomiting primarily, sometimes some abdominal pain, sometimes some diarrhea. You can see some irritation and pain at the injection site. Some people get a little dizzy with a headache, or can get a little tachycardia. Most of these patients we can treat safely at home. As long as you can, take some fluids in and not get dehydrated, the symptoms should be self-limiting. those that have end up going into the hospital, most of those are treated and released from the emergency department. So even though there are rare cases of things like gallstones and things like that, they're not very common, and I'm not sure that we've seen those cases in our center. But certainly a call to the Poison Center can help you determine what level of care you might need. But in most cases, fortunately, the symptoms would be self-limiting.
And have you all been seeing a steady rise in reports or maybe questions about some of these medications?
Clearly, I mean, we've looked back since 2016 and had 178 of these cases reported to us, and they're exponentially increasing. I think there were 42 reports just to our center, which is central in all of Eastern Virginia in 2023, and we've had 53 so far this year. Now, most of these seem to be the commercial products that are legitimate, and most of these are unintentional. We only have a handful that are intentional, and that would be I want to take extra to think I'm going to get an extra benefit, and then again, that's not using the product as directed. And so most of these are what we call, adverse drug reactions or a therapeutic error when you accidentally take the wrong dose.
And I want to ask too, in terms of, figuring out these medications and using them, the fact that they're not FDA approved for somebody that doesn't need let me reword that. They're not for weight loss. And I think some people over the counter or some people online are trying to get these drugs for weight loss reasons. Can you explain the danger of using a drug that might be for diabetes, for obesity, for weight loss, how dangerous that could be?
Well, remember, this is a prescription drug, and drugs are prescription because the FDA has made the determination that they cannot be used or should not be used without medical supervision. And that's really what dictates a prescription.
Right.
And so, these drugs have a lot of effects, as we mentioned earlier, on your pancreas to do with diabetes. But research is now showing they have a lot of effects in the brain as well. And one might be for appetite and for other urges. So I think we're probably at the tip of the iceberg in people doing research on these drugs. And they may become more prevalent for other things in addition to appetite control. But the fact that it's still prescription, they do have side effects. And it needs to be used under medical supervision. And that really should go for all comprehensive weight control programs that include exercise and diet and perhaps medication, that those should all be done in consultation with your doctor.
And having injectables, we know that, with diabetes patients, if they're managing their own insulin, there's also injectable medications that might help, for certain I'm trying to think certain, obviously a lot of other diseases. I know people with immune deficiencies. I've had, people that have used injectables for that. I mean, injectables are not only semaglutide related, but even with insulin and diabetes, and I'm sure that you all have received some calls on that, how dangerous it is to even get the wrong dosing, for a diabetic.
Well, that's very true. Certainly, too much diabetic medicine can lower your blood sugar to dangerous levels. And your brain is very sensitive to glucose levels. And so a low blood sugar for an extended period of time can be quite dangerous. So yes, drugs like semaglutide and these types of drugs do not notoriously produce hypoglycemia, even though there are a few cases out there. Maybe people that are also on other medications in addition to those. But many diabetes medications do produce significant amounts or potential for significant amounts of low blood sugar. And that can be extremely dangerous. And when injecting insulin would be one example where injecting too much could be dangerous.
And Dr. Rose, when you first heard about this FDA warning just about a week or two ago now, what was your first thought? Was this a long time coming? Are you hopeful that now they're sort of trying to give warnings to the public about some of these issues?
Well, FDA warnings do take some time to come out. They're looking for more than just a couple of cases. They want to look for patterns. They want to make sure that um, the effects are actually related to the drug in question and don't have what we call confounding variables. So there have been several reports by health reporters and stories like you're doing now to try to get the message out to the public. But I think we're going to keep seeing this. I mean, there's a huge demand for weight loss products. These drugs are expensive. They're difficult to get, and unfortunately, people are going to provide these things on the internet without the safety precautions we've talked about today. So I think we're going to continue to see it. But the FDA started doing things a month or two ago, and I think it's pretty well known now that these cases have been documented, and they've tested some of these products to know that they're contaminated or know that they have inaccurate concentrations of the active drug in some of these vials that are being sold over the internet.
Absolutely. And I know that people are trying to get their hands on it for hopefully the right reasons in terms of, using the medication during, periods of shortage. I know that in January we reported on, huge shortages of some of these medications. Sometimes, and the FDA said online, compounded medications can be all right, in times of shortages when you're trying to get your hands on something. But again, how important is it for you all, especially the Virginia Poison Center, for people to understand what's in that medication and not abuse it?
Well, I mean, COVID's a good example where compounded pharmacies played a huge role, and so I would just counsel people to not to do these types of things, not buy medications off the internet and use them in isolation. Let your doctor know. Tell your pharmacist. Don't do this. Without some kind of guidance. Obviously, we would encourage people to get a prescription and get a medication through a licensed pharmacy. But if the medication is coming from a legitimate licensed compounding pharmacy, then again that plays a role, and that's important. But it's really important not to go to some of these sites where they're charging you what seems to be a lot of money, but perhaps less than the drug legitimately cost. But some people are ordering these things and they're not coming in, and they want to get for example, the pre-filled syringe, and the company says, well, we need even more money to get that, and because we have to import it from Europe or something like that, and that should raise a huge red flag. And so it really is important that if you are going to pursue this, do your homework and make sure it's from a legitimate source.
Right, and that's a great consumer warning, which is what the FDA wanted to get out, especially as you just mentioned, counterfeiting situations. The FDA did send this alert out to providers, compounders, and consumers. Is that so, potentially they can educate the public too about you might need to go back to your pharmacist, you might need to go back to the compounder or go back to your provider if you have questions about how to inject the medication. I think of, EpiPen, right? They give you instructions on how to inject it in your leg. They give you a test one as well so that you understand the mechanics of how it's going to work. If you're injecting something at home, I know it can be difficult, but when you're measuring your own tools, you really do need to be diligent about what the process is.
Certainly true. And, this is a good example of having a relationship not only with your doctor or provider, but with your pharmacist. And I understand, people shop for medications and try to get a good price. I understand that. But if you go to one pharmacy and get to know the pharmacist or pharmacist there, establish a relationship, I can't imagine that they wouldn't be helpful if you brought in a product that you bought over the internet to help you to make sure that you knew how to use it correctly, even if they didn't dispense it, because that's what patient care, that's what patient safety is all about. And so I would think that most pharmacists would be willing to help you and do that, and think that that would be the right thing to do, even if they didn't sell the product.
And I want to say too, you mentioned not overusing over the counter medication. I'm thinking Tylenol. It's really specific limits on Tylenol bottles of what you can take, and that does vary by weight. It varies for children. How important is it to read the directions and read the labels? It might be just intuitive, but just stress. How important is that?
Well, it's very important. And, people think that if you can buy a medication over the counter, that it's not harmful. And that's certainly not true. Acetaminophen or Tylenol is probably one of the safest drugs in the world when used as directed. But if you misuse it, if you take too much, it can clearly damage your liver, and it's probably the number one cause of acute liver failure in the United States.
Wow.
So, but if you read all labels of over-the-counter pain medication, they'll all tell you if your pain's not resolved or improved in 3 to 4 days, see your doctor. Because remember, these medications are treating the symptom of pain, they're not treating the cause of the pain. And so medications like acetaminophen and aspirin and Advil and Aleve are much different than opiate or narcotic medications. And so there's a ceiling effect. And so if you taking 4 Tylenol extra strength gives you no more benefit than taking 2 Tylenol extra strength. But people think that the more pain medicine you take, the more relief you get. And that's just simply not true with most of these pain medications you can buy over the counter. So it's even more important to follow the instructions. And if your pain persists, don't keep taking excessive doses. Go see someone and address the cause of the pain.
Well, Dr. Rose, you said you've been hearing some of these messages since 2016. We're 8 years later into what this is, and it seems like there's even more drugs out there on the horizon. What do you urge people, to talk to their providers, to call you all? I mean, what's the best step in this situation if they're having a reaction? Can you just walk us through? I know that you mentioned, what the Virginia Poison Center can do for you, but just if other people are joining, can you reiterate, what's the best step if you're seeing something at home?
Well, if you accidentally take too much, and we hope you're not doing this intentionally because excessive doses don't produce extra weight loss, they just produce side effects, um, is a first call to the Poison Center. We can help you decide whether the symptoms are severe enough that you should seek medical care or whether you can manage this at home. Keep your fluid intake up. But if you cannot keep food down, you cannot keep liquids down, you're vomiting frequently, you have really bad abdominal pain, then perhaps we would direct you to probably an emergency department or at least an urgent care center, and they could give you some medicine for the nausea, get you rehydrated. Unfortunately, most of these symptoms shouldn't last too long. In the worst case scenario, they can check some blood work, your electrolytes, make sure your blood sugar is okay, things like that. So first call to the Poison Center. If you're really having difficulty breathing or some other weird thing like a lot of CNS depression or someone seems to be losing consciousness, then that's a call to 911. But that would not be expected from these type medications. But if you take other diabetic medications with it, then there is the risk for low blood sugar, and that would be more of a medical concern, immediate medical concern.
Absolutely. And I want to highlight, we're talking about semaglutide products, and you're seeing some Ozempics and Wegovy on screen. The compounded semaglutide is not about that, but I think your guidance proves to that as well as also other medication. Take the dosage prescribed, by your provider, even if it is for the licensed reason, even if you're using it for anti-obesity medication or for diabetic medication, you still want to abide by the rules set by the provider.
There's no question. And if there's no provider, in other words, if you've gone to the internet for these things and they give you instructions, please double check those instructions with your pharmacist or provider because in some of these cases, the instructions have been wrong. And that's what's led to some of the excessive dosing and overdosing that's happened with these, internet-based products, particularly if you have to draw the medication up with a syringe. And so, it's really, an ounce of prevention is worth a pound of cure. So make sure that you understand it, you know that the right volume and how to inject it safely.
Absolutely. Well, Dr. Rose, thank you so much for joining us this morning. I mean, is there any other notes that you wanted to tell our viewers, just tell people in Virginia about this warning by the FDA, or similarly advice, in terms of how to manage their medication?
Well, certainly medication management is a big part of staying healthy and managing chronic diseases. Uh, you know, Compliance to medication is critically important. If for some reason you don't want to or you can't tolerate your medication, tell somebody. Tell your pharmacist, tell your doctor. There are a lot of things that they can do to help you be compliant with the medication. And things like blood pressure, you can't feel necessarily that your blood pressure is high. And so people might not tend to fill their blood pressure prescription or to take it. So those are really critically important. Um, I think the demand, as we've talked about, for these weight loss products like semaglutide and others is not going to go away. And if you find yourself in the situation that the only way you can get this medication is off the internet, um, again, don't do it in isolation. Make sure you communicate with your doctor and your pharmacist. Make sure you go to a legitimate source of the medication, and double check and triple check the dose to make sure that you're giving yourself the right dose.
Absolutely. Well, Dr. Rose, thank you again. And it sounds like, unfortunately, we might be having this conversation again. But just if anyone's watching today, this will be on WAVY.com, YouTube, and Facebook saved. It also will be with more information on WAVY.com about how you can contact the Virginia Poison Center and find out more information about that resource that we have. But Dr. Rose, thank you again.
My pleasure.